But like living in Estonia was great. We traveled a lot, and we lived there for about a year, and we traveled around Europe. We took advantage of cheap flights and buses and trains and stuff like that around in Europe, and we traveled quite a bit, visited a lot of places. And the place we really, really liked was Riga, Latvia.
Mm-hmm.
And so that first year living in Estonia was supposed to be like a test run. So we still had our house and cars and furniture and stuff in North Carolina. So we decided after a year in Estonia, we moved back to North Carolina with the intention of selling stuff. And then we would move back to Latvia after we sold our stuff. So a few months later, after we liquidated everything, we moved back to Latvia, and that's how Latvia happened.
Hello, family around the world. Have you ever wondered what it takes to pack up your life and start over in a new country or in multiple countries? Well, you're in the right place. Welcome to Expat on a Budget, the show where we explore the highs, the lows, and the crazy adventures of living abroad. I'm your host, Kimberly Ann, and in every episode, I interview the expats and nomads who are actually living the dream to find out how they did it and how you can too. Bobby Casey is a lifelong entrepreneur and international tax strategist, and the managing partner of Global Wealth Protection, as well as the founder of BusinessAnywhere. He specializes in helping digital nomads, investors, and business owners legally reduce their tax burden, protect assets, and structure companies for maximum flexibility and privacy. So, welcome. Today we are here with Bobby Casey. And Bobby is an international tax lawyer currently located in Mexico. And can you tell us a little bit about what you do and then where in Mexico you are first?
Sure. Yeah, no problem. First of all, Kimberly, thanks for having me on. I appreciate it. I am international tax lawyer. I specialize in working with location independent entrepreneurs, freelancers, that type of thing. Basically, people who live outside of their home country, because it gets pretty complicated sometimes when you live outside of your home country, trying to figure out what to do about like your business registration, where and if and how you pay tax, and banking, and how to get paid by clients, and how to move money around, stuff like that. It gets really complicated when you've got a couple of different countries involved, especially if you're a digital nomad and you're bouncing between countries every month or every few weeks or something like that. So I've been doing that for about, more than 20 years, 20 plus years. And over the years, I had other things that we needed to refer out to clients, like where to register your company or setting up trusts or getting residency and those types of things. And so over the years, I actually just started some of those other companies. And so our main company now is BusinessAnywhere.io, where we do company formation, registered agent service, virtual mailbox service, helping people open bank accounts. We do basically everything for your startup: registering your company, opening a bank account, getting your tax ID number, your mailbox address, your bookkeeping, accounting, tax filings, basically everything, including tax consulting to make sure you got the right structure in place. So we can go into more of that if you want to. I don't know exactly what all you got in store for us to chat about today, but we can go into more in depth about like mistakes people make and that kind of thing, if that would be appealing to your audience. If not, no big deal. And then you wanted me to tell you where I'm at right now. So at the moment, I am in Playa del Carmen, Mexico. For the past few years, this has kind of been my winter home. I have traveled a lot, I don't know, over the years, probably 80 plus countries. I've lived in about 10 different countries. And currently I have 3 home bases. And so I just kind of move. Mainly I move between my 3 home bases, but I also still travel a bit in the middle. Like in an average year, I'll probably visit like 8 to 10 countries, which for some people sound like a lot, but compared to what I was doing 10 years ago, it's considerably less now. Now it's much more settled. So I just kind of moved between 3 countries with short jaunts here and there to other places.
Okay, and what are those 3 countries? Mexico?
Mexico, yeah. Latvia. So I've had a home in Latvia for about 15 years now. So that's one of my home bases. And then North Carolina. I'm originally from North Carolina. I still have a place there. But to be honest, I spend less of my time in North Carolina than anywhere else. I spend most of my time between Mexico and Latvia. I just maintain a place in North Carolina for 2 reasons: to see family and to ride my motorcycle while I'm there. So that's about it.
Okay, that's fair. Understand. Now, why Latvia?
Oh, well, that is a pretty long-winded question, but I moved to Estonia first. At the time, I was married to my first wife, and we moved to Estonia as just kind of a test to see if we wanted to live abroad. So the next question, presumably, is why Estonia? So Estonia, it was just kind of on a whim a little bit. I speak some Russian. At the time, I was learning Russian. Now I speak a bit better, but not great. I speak some Russian, and I thought it would be interesting to go live in like a former Soviet country where I could practice speaking Russian more. And I had a friend who had lived in Estonia before, and they said, "Oh, you'll love it. It's great." So we moved on a whim. Literally, we'd never been to Estonia before. Well, I don't think 2 years earlier I'd even heard the word Estonia. I don't think I'd ever even heard of the country before that. We moved there with my wife and 3 kids. We didn't do any pre-planning, 0 of 0 of 0. Like, I didn't even think about where we were going to live, and I didn't even make an effort to figure out where we were going to put the kids in school. Like, wow. 0 of 0.
Did you move to Tallinn?
No, we moved to Tartu, which is the second biggest city in Estonia. And yeah, it was a just funny story. I went there so I have 3 kids, my oldest daughter, and then I have a middle son, and then my younger son. They're all grown now, but I went there. We went to Europe on a backpacking trip with my oldest son, my middle kid. 2 of us went first, and we went to Poland and backpack around in Europe for a couple weeks and ended up in Estonia to get settled before my wife and other 2 kids showed up a bit later. And one day we just happened to be walking through the town square, the city center square. And a woman approached us, said, "Hey, I hear you guys speaking English. Are you American?" And we said, "Yeah, we are." And she goes, "Oh, that's cool. I'm American too. I just moved here with my husband and 3 kids. I got a daughter and two kids." And she said, "Both my boys are about your son's age." I'm like, "Oh, that's great. Yeah, we should probably connect sometime. I'm sure like kids will like to have some friends." And she goes, "What are you doing for school for your kids?" I'm like, "No clue. I had no clue. Literally 0. She said, "Well, there's a meeting tonight at this school in town, and that's where I'm enrolling my kids. If you want to show up, you could probably just enroll your kids there." And I'm like, "Huh, okay." So I showed up, and that's how we found the school for the kids. But like living in Estonia was great. We traveled a lot, and we lived there for about a year, and we traveled around Europe. We took advantage of, cheap flights and buses and trains and stuff like that around in Europe. And we traveled quite a bit, visited a lot of places. And the place we really, really liked was Riga, Latvia. Mm-hmm. And so that first year living in Estonia was supposed to be like a test run. So we still had our house and cars and furniture and stuff in North Carolina. So we decided after a year in Estonia, we moved back to North Carolina with the intention of selling stuff. And then we would move back to Latvia after we sold our stuff. So a few months later, after we liquidated everything, we moved back to Latvia, and that's how Latvia happened. And then ironically, we moved to Latvia in 2011. 2 years later, my wife and I separated. So then I was there as a single guy, which was good for a while. And then I ended up meeting a Latvian woman who I then married. So.
Oh, that's cool.
Yeah. Which, by the way, her and I are now divorced. So I am now twice divorced. Yeah, it happens. And Nothing bad. Like it's all good. Actually, my Latvian ex-wife lives in Mexico, probably, I don't know, 3 or 4 blocks away from me right now. We see each other, we see each other just kind of walking on the street all the time. So we're completely friendly. Everything's good. We say hey to each other and stuff like that.
Yeah.
It was just kind of ironic that we now both live in Mexico, very close to each other.
Yeah, that's interesting. Well, you obviously have similar interests.
Well, we had lived here together. Her and I had lived here together.
Oh, okay.
While we were still married. And she decided she just really liked it here and just wanted to stay. And I said, well, I'm going to leave. And I left. But then I'm like, you know what? I really like this place in the winter. So I came back again the next winter.
Okay. That makes more sense. Yeah. But it's always good to stay friends with the exes if you can.
Yeah.
Yeah.
If it's possible.
If it's possible, yeah. So we were talking a little bit before we started recording, and you currently have 4 residencies, including the United States. And how does that work? And
I mean, if you're a U.S. citizen, they are technically, I guess there's two countries that have citizenship-based taxation, but the U.S. is a bit unique in that regard. So if you're a citizen of the U.S., you are a tax resident, no matter where you live in the world. So I do still, by law, have residency in the U.S., tax residency, but I don't have physical residency in the U.S. anymore. It's not considered my domicile anymore, but as a U.S. citizen, I do still have tax residency there. And then I have residency in Latvia. I have permanent residency there. I've been there a long time. I have permanent residency in Mexico. And then I have permanent residency in Italy as well.
Okay. And how did you get those residencies?
Italy was through family, family connection, not mine, but my first wife. She was Italian, or she was not Italian. Her, I think grandmother or great grandmother, I forgot, was Italian. And so we wanted to go through the process for her and the kids to get their Italian citizenship. And the fastest way to do that was to get residency and to go live in Italy for a while, because it dramatically expedites the process for obtaining citizenship through jus sanguine. Jus sanguine is through ancestral connection in Italy.
Right. Okay.
So it dramatically speeds up that process. So if you have Italian ancestry, let's say your grandpa was from Italy and you want to get Italian citizenship, you can do it. You can apply through the consulate in your home country, but it's probably going to take you 4 or 5 years to get that process done, because it takes forever to get consulate appointments for that stuff. And then if you fill in one form wrong, you don't cross a T or dot an I correctly, they'll cancel your appointment and set you an appointment a year later or something like that. So it's kind of a hassle to do it through the consulate. I have a lot of clients that have done that have gotten their Italian citizenship through the consulate. It just takes a long time. The alternative option is to just go live in Italy, get residency, and apply for citizenship as an Italian resident. And so if you do that, the process happens locally in the village or the town or the city where you're living. And so it happens much faster. It's approved locally, and then it's confirmed in Rome at the government office. And so we ended up getting, we had the kids' passports in hand in less than 6 months.
Oh, nice. Yeah, I have a friend who did that, and she was able in less than 6 months as well.
Yeah, so she probably did it by living in Italy.
Yeah,
so,
she did. She moved to Sicily. Absolutely, yeah.
So yeah, that was Italy. It was done in that way, and it was nice. We actually lived in a kind of countryside village, which was actually really cool to live in a different kind of place, completely different kind of lifestyle, living in a countryside village.
Yeah. So what village were you in?
It's been a long time. So honestly, I don't remember the name of it. It was east and south of Rome, a couple hours, but I don't remember the name of it.
Okay.
Well, you asked me about my other 2, the ones I have currently. Mexico is pretty easy. They keep raising the income requirements, but as long as you meet the income requirements, it's still pretty easy to do. Most of Latin America, to get residency, all you have to do is prove you have money, as long as you have some income or some assets or some investments or something like that, most of Latin America will approve residency. Whereas Europe is different. You have to prove you have a reason to be there. So like you have to have a job or a business or an investment in that country, or you're a student or you're a teacher or something. You have to have some specific reason to have residency in most European countries. So there's a reason why in most Latin American countries, when you look at the minimum income requirements to apply for residency,
right,
like it can be 10 or 20 or 30 times the minimum wage in that country. And so they're literally intentionally attracting people that make a lot more money because they know you're going to go live there, you're going to spend money, and it's going to bring economic growth to that particular region where you're living. It's actually, I think it's pretty smart, especially in today's world where we have the technology tools to kind of live and work anywhere we want. A lot of us do. Obviously, if you're a plumber, you don't, or if you're a doctor, you don't. Electrician, no. But if you have any type of service, like digital service business or digital product business, or even, in many cases, physical product business, but you can outsource a lot of things like product fulfillment and stuff like that. We can live and work anywhere. And so from Latin America's perspective, that's a pretty smart way to go to attract people that make more money, because you're literally incentivizing people who make more money than your average citizen to come and spend money.
Right.
Whereas Europe, I think, has completely the wrong immigration approach. Is they are very restrictive on who they want to immigrate there. So there's two sides to this coin in Europe. They're very restrictive on who they want to immigrate. For example, like basically everyone I know has their own business. I don't really know people that have jobs. Like it's just nothing wrong with it. It's just that I don't have those friends and almost everyone I know that has their own business, they work remotely, or at least partially remotely. Maybe they have an office with a business and they'll go travel for a month and then come back to the office or something like that. And so if they want to go live in, I don't know, let's say France, for example, it's extremely difficult for them to integrate to France because France doesn't have a way for somebody who has their own business in another country to immigrate, because they say, well, why do you want to be here? And so because they don't make it easy for you to, well, people don't. They just don't do it. So they're kind of shutting the door out on high income people, high net worth people to come into the country. And the flip side to that is a lot of European countries make it insanely easy to immigrate if you're a refugee. And this is not anything bad or to disparage refugees. I mean, if you got a bad situation in your home country, I think, there should be some way for you to go somewhere else. But you've got to balance that out. Like Germany, for example, literally gives an incentive, like quite a large incentive for refugees to come to Germany. And at the very same time, they intentionally block high income and high net worth people to come and live in Germany unless they're going to have a job or teach or go to university or something like that. So it's a disincentive for high income people to move there, and a big incentive for low and zero income people to move there to get government benefits.
We'll get right back to the conversation in just a second. But first, if you're listening to this and thinking, I want to do this, but I just don't know where to start, I've got you covered. My signature online course, the Expat Launchpad, is designed to take you from confused to confident about your move abroad. It's robust, really robust. It's easy to follow, and it's currently on sale for a limited time. Don't let the logistics hold you back from your dream life. Click the link in the show notes and sign up today, or go directly to expatonabudget.com/workwithme. All right, back to the podcast.
I probably have a counter view on immigration. I believe in open borders. I think every country should have open borders.
Yeah, I agree too.
I think the problem,
but then don't kick us out.
Well, I think the problem with a lot of countries especially Western countries, the US, Canada, most of Europe. The big problem they have is the welfare state's too big. So you have an incentive for these people to come who have no income or very low income, and they can come in and they receive all these free benefits. You got free money, free food, free healthcare, free education. All these things are free that are funded by taxpayers. So you've got a kind of an argument there. So people say, we don't want open borders. What you really don't want is the welfare state. But see, people don't want to give up the welfare state because you don't want to give up your freebies. You don't want to give up your free healthcare, or you don't want to give up your free X or Y or Z. And so it's a catch-22. You're like, we want to close the borders so nobody gets our free stuff. Is essentially what they're saying.
Yeah.
Is we don't want other people to get our free stuff. So I'm a big believer in open borders, but I'm also a big believer in eliminating the welfare state. Let's get rid of it. And let's have open borders so that people move to a country because they want to be there and for the opportunity that presents itself to be there, not because I'm going to get free stuff by moving there. Like in Europe, a good example is your Baltic countries like Estonia, Latvia, and Lithuania. They have, because of European Union guidelines, all the EU countries have to give some benefits to refugees, like some free money, some welfare. However, the Baltic states give the bare minimum, like minimum. They get almost nothing, like 100 euros a month or something like that to go live in the Baltic states. Whereas you've got countries like Germany or France where they can get close to 1,000 euros a month. And so you end up with, let's say, a family of 4 refugees, maybe from, I don't know, some Syria or something like that. And they come in and they're going to get 4,000 euros a month if they move to Germany or something like that, approximately. Or they're going to get 400 euros a month when they go to Estonia. Where would you go if you were the refugee? Obviously, you're going to go where you're going to get more of the free stuff. And that's why you have almost zero refugee issues in Latvia or Estonia or Lithuania. And it's a big problem in places like Germany and France.
Oh, that's
like
interesting.
Latvia has a lot of immigrants. I've noticed in the past couple of years, especially, there's a lot of immigrants from India and Pakistan. However, they're not getting free benefits. They're coming there and they're starting businesses. Yeah. They're working. Yeah. They're getting jobs, and it's working. Like they're improving the economic output of the whole country by moving there. So great, let them come. Awesome.
Right. But that's the same thing that's happening here. It's a lot of Indian and Bangladeshis. And anyway, we have a new right-wing government that is not happy. But they just started a new thing in France. It hasn't gone through yet, but I think it's been approved, where they're going to charge expats specifically on the visitor visa. They're going to charge money for the health insurance. So they won't have free public, access to health insurance because they're not paying into it. And that sounds fair to me. Yeah. Yeah.
In Latvia, if you don't pay into the health insurance system, you don't get free healthcare. You don't get, if you are like, I'm a permanent resident there, but I'm not a tax resident there because I don't meet the tax resident qualifications to be a tax resident. So I don't pay into the social insurance system in there because I'm not a tax resident. So if I go to the doctor, they can see in the system, they ask for my ID card with my personal code, and they can see that I don't have rights for free healthcare. I say free. It's not free.
Universal healthcare. Yeah.
You pay for it through your social insurance system, but I don't get it because I don't pay into it. Okay, great. That's fine. I'm not asking for something for free. So I just pay out of pocket when I go to the doctor, and it works completely fine for me.
Right.
Whereas other countries like France, if you have residency there, you get free healthcare. Full stop. In the U.S., you do too.
You get free healthcare?
Oh yeah. People don't really understand that. People like the U.S. is an interesting place. People think like, oh, I can go bankrupt because of the healthcare system. It's not really true. It's really only true if you're stupid, to be
Wow.
honest.
Because I know people who have.
Right. I know people who have too, and they're stupid. I'll be straight up with you. They're stupid because in the U.S., like for example, first of all, if you at a low income level, I mean, you can get Medicaid. So it's free healthcare.
I was an acupuncturist, and I had all my patients were all getting free acupuncture.
Yeah, so you can get free healthcare with Medicaid if you meet the income threshold requirements to do that, or Medicare if you're old enough. You
or
meet
Medi-Cal.
the age requirement.
They were Medi-Cal.
Yeah, in California.
Yeah, in California.
Yeah, that's one thing, you can get free healthcare. Another is if you're sick, you can go to the emergency room in any hospital anywhere in the U.S. and they have to treat you no matter what. Like you can go in with a broken arm, they can't say, let me see your insurance before we treat you. They have to treat you first. Let's say you go into the emergency room, I don't know, let's say something big, leukemia. I mean, that's big, right? So you go in and you go to the hospital and you say, I got leukemia, treat me. Well, they have to treat you because they can't turn you away for lack of ability to pay. They can't. By law, you can't turn people away in the U.S.
Right.
Actually, in most countries, you can't turn people away. Some countries you can, but most countries you cannot turn someone away for like necessary treatment. Now, you can turn someone away if they want a nose job or a facelift or a boob job or whatever.
Something not needed.
Kind of some elective treatment that you didn't really need. But if you got cancer or a broken arm or you're in a car wreck or something, most countries have to treat you. So in the U.S., you go and you get leukemia. So this actually happened to me, or not me, sorry, it happened to a friend of mine a few years ago. He actually makes pretty good money, but he just thought having health insurance was a waste of money. And I agree with him. So he had leukemia. He went into the doctor and they treated him. And he had an adverse reaction to their first type of treatment because he had a very rare form of leukemia that didn't react well. And he was in the hospital for about a month because of this adverse reaction. And so you and I both know if you go to the hospital in the US for a month, that's an insane amount of money. Insane. It is an ungodly amount of money. Like just something like $4,000 a day just for the room.
Yeah.
And then you've got every time the nurse walks into the room and checks your chart, you're paying $27 for aspirin or crazy things like that, right?
Yeah.
So at the end of his stay, the administrator came in and said, "Look, I see you don't have insurance. How do you plan to pay for this?" And he said, "I don't know. I don't have the money for it." And what they did is they went and helped him find an insurance carrier that would cover him going forward, even though he obviously had a pre-existing condition. I mean, he was in the hospital for leukemia. So the administrator helped him find an insurance carrier who would help pay for it from that point forward. Mm-hmm. But he already had, by the time the insurance took effect, I think he had like a $2 million bill with the hospital.
Yep.
And so the insurance was taking care of it for $2 million and one forward, if that makes sense. But they said, "What are you going to do about this $2 million?" He goes, "I can't pay it." And so what they did is they ended up settling it for pennies on the dollar and put him on a monthly payment plan. And just wrote it off. But I mean, they wrote it off for literally, I want to say it was something like 3 or 4 cents on the dollar is what they wrote it off for. And so in the US, you cannot be forced to pay more than you can afford for your health insurance.
But they're going to put you on a payment plan. I went to the hospital once and I couldn't afford it. And they put me on a pretty high payment plan for years because they want their money.
But that's because you don't understand their game. So I'll explain this to you. So I went down this road myself, and I probably 3 or 4 years ago, I was in the US, and I normally don't go to the doctor in the US, but I'm like, well, I'm here for about a month and I need to get this done. So fine, I'll do it while I'm here. So I went and had an endoscopy and a colonoscopy. And I went to the doctor and I said, "How much is it going to be?" And they said, "Okay, it's funny too, because when you go to the doctor in the US, they say, who is your insurance carrier? Not do you have insurance? They say, who is your insurance carrier? And I said, I don't have insurance. And the lady looked at me like I was an alien, like I was from another planet, because like nobody doesn't have insurance. Okay. So I said, I don't have insurance. She goes, what? You don't have insurance? I'm like, no, I'll just pay for it. She goes, okay. So she prints me off the bill of what it's going to be. And on the bill, it tells me what the bill is going to be if I had insurance and the amount of money they bill to the insurance company. And then it tells me what my cash price is, what my amount is. Okay. So the bill for the insurance company was over $5,000. The bill to me was $2,000. Okay. And so I did the math on that. It's actually cheaper for me to not have insurance and pay these things out of pocket, because I would have had to have had insurance before I made that first appointment. So let's say 6 months in advance, I would have had to have had like health insurance. And I'm 51 years old, so I probably would have been paying $800 to $1,000 a month for health insurance plan. Let's say $1,000 a month for 6 months. So that's $6,000 I would have paid in premiums. I would have also had to pay. I would have only gotten like 80% of that 5,000 paid, because you always have a 20% deductible. So 20% of 5,000 is $1,000. So 6,000 in premiums plus another 1,000 in deductible is $7,000 I would have paid if I had insurance. Or I pay 2,000 directly to the doctor. Okay. Now it gets better. Okay. So after the treatment and everything was done, I left and went to the office counter, and I said, okay, you want to check out, and handed her the bill. She goes, okay, that'll be $2,000. And I said, okay. She said, how would you like to pay? And I said, well, how can I pay? And she said, well, you can pay it all up front right now, cash, check, credit card, whatever. Or you can pay some of it now, and then we'll send you a bill. You pay the rest later. She said, or you can pay nothing now, and then you can pay it later. She said, or you can pay us monthly until you pay it off, whatever. I said, oh, really? Okay. I said, if I pay you monthly, like how much do I have to pay you monthly? And she goes, like, technically speaking, she said, you can pay us any amount you want. I said, what do you mean? She said, well, you can actually pay us any amount you want. She said, I'm not really supposed to tell you that, but by law, you can actually pay us any amount of money you want, of whatever you can afford, until it pays off. And I said, and if I pay you $1 a month for 2,000 months, like I can do that? She said, well, we'd rather you didn't do that, but technically you can. And as long as you're making a monthly payment. Also, I don't know if you know this, but medical bills you can't get a bad credit report for medical bills.
Oh, okay. Okay.
You can't get your medical.
But they send you to collections. So she said, we can't send you to collections for $1 a month.
They can't. Yeah, she said, we can't send you to collections as long as you pay us $1 a month. So I thought that was really interesting. And so then I did a deep research on this in the Healthcare Act, and I looked all this up, and it's true. You can actually pay any amount of money that you deem affordable to you every month until you pay off your bill.
And is that in every state, or is it? Wow. In every state. That's interesting.
So that's what I'm telling you. Wow. Most people in the US do not understand that.
Or don't know
and
it.
So, and they end up going broke because the doctor says you owe us $1 million, and you're like, oh, I can't pay it. And then you end up doing things like getting a second or a third mortgage on your house to pay this hospital bill, when in fact, you shouldn't be doing that. You should literally just be paying. You should look at your budget and whatever you make, and you say, okay, I'll pay you $200 a month until I'm dead.
Well, it's interesting. My sister had.
In other words, people bankrupt themselves. People do it to themselves when it's unnecessary.
Well, they don't know. I mean, it's ignorance. Exactly. You don't know. So my sister had a heart attack. She rode and did the ambulance, got to the hospital. They saved her life, blah, blah, blah. Okay, which is great.
Ambulance rides are crazy expensive.
I know. And I don't mean to say blah, blah, blah. It's amazing. Okay. So then they give her the bill, and the bill is exorbitant. It's whatever, several $100,000, 500,000, we'll just say. And she says, number one, I don't have the money. Number two, I want to see the rundown. Send me every single line item. Then she calls them. She said, this is not true. This never happened. This is not true. This never happened. Show me the proof. By the end, the bill was down to a couple hundred. I mean, it was just almost nothing. And how she got the ambulance, they took back the ambulance. It took back everything. But she's very proactive, we'll just say. And she ended up.
Well, there's a lot of, I don't know how else to say this, but there's a lot of bullshit when it comes to medical billing.
True.
And they take advantage of people's lack of understanding and it's fear. Like in fear. Yeah. They scare you into believing here's a bill for $500,000. Like, oh my God, I owe the hospital all this money. What am I going to do? Here's the thing. I haven't had health insurance in 18 years.
Wow.
I don't want it.
Wow.
Like, I don't like, I just refuse to have health insurance because it's a waste of money. It's a waste of time. I'm self-insured. And for the most part, I go to the doctor in other countries. I arbitrage things. I know if I need to do like whatever, XYZ, I know this country is good for this and I travel anyway. So I'm going to go to that country. But people don't realize, like a great example of this is LASIK surgery. Okay. People go to the US to do LASIK surgery. And I think now it's like $2,500 an eye, roughly, to do LASIK, something like that.
Okay.
Well, you can go to Lithuania and do LASIK surgery for about $300 to $400 per eye.
Wow.
Okay. You can pay $5,000 to do it in, I don't know, California, or you can get on a plane and fly to Lithuania. Also, by the way, I will tell you, I've been to eye doctors in Lithuania, and it's comparatively, going to the eye doctor in Lithuania is like going to the eye doctor on the Star Trek Enterprise compared to going to an eye doctor in a cave when you go to California.
Wow. Okay.
It's the U.S. the eye doctors in the U.S. are like 20 years behind the eye doctors in Lithuania.
Wow.
You can go, you can buy a plane ticket to go there, spend a week visiting a new place, make a vacation out of it, have an amazing trip, and see Old Town Vilnius and have an amazing trip and still spend less than you would have spent than going to the doctor in California. But people have the mindset that I'm from California. I got to go to the doctor in California because I live here. Like I have friends I'm originally from North Carolina. I have friends who have done this. And I've told them, I'm like, do not go to your local doctor. I will literally tell you the clinic to go to in Lithuania. And they're like, oh, well, I'm just going to do it here because I'm here. I'm like, you can spend $600-700 on your surgery in Lithuania and get a much better treatment, or spend $5,000 here. You can spend, let's say, $1,500 on a round trip plane ticket, another $1,000 on hotels for a week or something like that, and have an amazing trip for about $3,000.
Right.
And get your surgery done.
Right.
Or spend $5,000 with your local doctor.
Wow.
So like me personally, I don't go to the doctor in the US for the most part. Like occasionally I will, like the endoscopy and colonoscopy I did. But for the most part, I always go to the doctor somewhere else.
So you don't get travel insurance when you go anywhere?
Technically, I have travel insurance on my credit card.
Yeah, that's true. That's true.
Technically, I have travel insurance, but I've never used it.
Yeah. Yeah.
I also, I look at healthcare as my responsibility. Mm-hmm. Like I go to the gym 4 times a week. I walk 10,000 steps a day. Mm-hmm. I do yoga and stretching every morning. Sometimes I'll jump rope, swim laps in the pool. Mm-hmm. I eat healthy. I get lots of protein. I take a multitude. I'm sitting here looking at my supplements right over there. I take a multitude of supplements every day. I look at healthcare as preventive, not reactive medicine. And so I just don't really get sick. Right. First of all. Yeah. Of course, things happen. And to be honest, like if I was like my friend in Florida and I went to the doctor here and found out I had leukemia, I'd probably fly back to the U.S. to do it.
Yeah.
I would fly back to the U.S. because I know how to manage the system in the US. But if I have like, if I want LASIK surgery, I wouldn't go to the US. If I want to go, like my functional medicine doctor is in Latvia that I deal with, like my annual physicals, and I go there and get like injections and stuff like that. I do that when I'm in Latvia in the summertime every year. I have a sports medicine doctor here in Mexico where I do a lot of treatments with him here. I get my stuff from him here. Yeah, I just don't have health insurance. It's a waste of money.
Wow.
It's a complete waste of money.
And FYI, we have the second half of Bobby's interview coming up. And it's not in the next episode because I had a couple people to move before him, but it will be in 2 or 3 episodes from now. Oh, and it is about forming a company in the US while living abroad and the pluses and minuses of doing so. I really appreciate you spending time with us today. If you loved these stories and you want to keep that momentum going, you'll love my archived podcast, which is still available on Apple and Spotify. It's called An Unknown Adventure. I have links below. For those of you specifically eyeing Portugal and beyond, don't forget that the first 40 episodes of this podcast are my personal blueprint on how I made the move. And listen, you don't have to do this alone. Whether you need a full online course or one-on-one coaching, I've got options to help you make your move a reality. You can find links to my course, which is on sale right now, and my consulting packages in the description. Happy travels!